Hi, all. My name is Dr. Elle Saine. I'm an infectious diseases fellow physician and epidemiologist and a Doctors for America health advocate. And I'm excited to share my story of advocacy with you and talk to you about Advocacy 101, the fundamentals of how you can get involved in being a health advocate. So, first, I want to tell you a little bit about my background and my story and my journey to health advocacy. So, my journey to advocacy really started at about the age of 7 years old. When I was in the second grade, I was living in rural Pennsylvania in Berks County, right about here. It's about an hour away from Philadelphia. And two of my friends were hit by a motor vehicle and were killed, a brother and a sister, while playing in the streets. And for about the 6 months prior to their deaths, my mother had been advocating for a traffic light or a speed bump to be put in on our street in our neighborhood because cars would just fly down the street and not stop at the stop sign. And myself and many of my friends had almost been hit by cars multiple times. And so she'd gone around getting neighbors to sign um, petitions, and she had gone to the town council meetings, and nothing had really happened. And so when two of my classmates died, at the age of 7, I asked my mother if I could speak in front of the town council. Because while I was only 7 years old and I didn't even know what advocacy was at the time, I had been raised with a strong sense that my voice matters and that I should use that voice to put good into the world. And so my thought process had been that if they won't listen to the adults, maybe they'll listen to a kid talking about another kid whose friends had died. And so this is a picture of me in the local newspaper from the town council meeting, yelling at the town council members about my classmates who died and advocating for better precautions to be put in our neighborhood. We didn't get a traffic light, but we did get a speed bump. Mm. So flash forward nearly 20 years. And I was living in New York and I was in graduate school in 2011 when Occupy Wall Street started. And so this was my first ever protest. I participated in a student walkout in solidarity with Occupy Wall Street. And so in this bottom picture is a bunch of my colleagues and professors from the anthropology department at NYU participating in this walkout. And there had been a lot of media coverage about Occupy Wall Street and a lot of information that had gotten out there about what Occupy Wall Street did and didn't represent. And I found participating in this protest to be incredibly eye-opening. And so I wrote this piece that was published in American Ethnologist about the experience of participating in the Occupy Wall Street protest. And the real thesis statement that I took away from this is that democracy is not a spectator sport, but it's something that we have to actively engage in and fight for and maintain. And so, using our voices to amplify the issues that matter most to us, and particularly to amplify the issues that impact the needs and the well being of others, is really, really key. And so, I took this drive and this passion for using my voice and using my voice to try to make the world a better place for the people around me. And I parlayed that unsurprisingly into health advocacy. So in 2023, I joined Doctors for America. And in that time, I've had the honor of serving as the co chair of the Public Health Task Force, which is within community health and prevention, one of our impact areas, where we focus on public health issues. And also in that impact area are gun violence prevention and substance use disorders. So, really focusing on the health and safety of communities. I went to the National Leadership Conference in 2024, where I met the former Surgeon General and one of the co-founders of DFA, Vivek Murthy. Here I am with my co-chair, Noah Ilitsky, and I with him at the National Leadership Conference. And I've also had the great experience of advocating on the Hill multiple times with the FDA task force during fly-ins, talking to legislators about FDA funding, FDA policies, as well as vaccine access and regulation. And so, why do we advocate? Why is it so important to have our voices heard, and why is health advocacy such an important part of being a physician? Well, advocacy is really fundamental to being able to provide the best care possible for our patients. Dr. Rudolph Virchow, who most of you probably know from his biomedical and physiologic advancements, also was a really key social advocate, and he had a very strong theory of the impact of social medicine on health, particularly the impact of on poverty, on disease outcomes. And Virchow said that if medicine is to fulfill her great task, then she must enter the political and social life. In fact, advocacy is considered a core competency of physicians by the American Medical Association in their Declaration of Professional Responsibilities in 2004, where they stated that advocating for social, economic, educational, and political changes that ameliorate suffering and contribute to human well being is one of the responsibilities of a physician. And there's many different ways that you can advocate. There's no one right way to advocate. You should advocate about the issues that matter to you, the things that matter most to you that are impacting you or impacting your patients. And the ways that you advocate may depend on the issues that you want to speak out about. So you may be advocating at the individual patient level, working with communities, advocating for local change, advocating within the health system for things for your patients or for better conditions for your colleagues. And kind of the pinnacle of all of this is trying to implement some policy change, be that at the local level, be that at the institutional level, or be that at the national level. And so to get started, really, you need to find an issue that matters to you and do your best to try to understand it, work with others to really understand the issue. Identify key decision makers, including recognizing who are your allies and who are the people who are going to disagree with you and what's the argument going to be against what you're advocating for. Develop recommendations and a strategy, and then really think about what's the outcome, what's the goal that you want to achieve, and how are you going to evaluate whether or not you achieve that goal. And so I always say, have your moonshot goal, the big thing that if you could do anything, you would shoot for. Have your short-term goal and have your long-term goal. So the short-term goal of what you're trying to achieve right away, the long-term goal of, what do you want to achieve like in the next year, in the next 5 years. And the moonshot goal is that thing that you're reaching for of what we can always do, we can always be better. Maybe it's not achievable, but it helps you plot small steps that you can take of short and long-term goals to try to push us in that direction. And don't forget, stories are powerful. And so your story and your experiences are the most powerful tool at your disposal. And there's so many different ways that you can advocate, so many different actions that you can take. This is a non-inclusive list of just some of them. And I'm actually going to walk you through a toolkit that we developed in the Public Health Task Force called 5 Daily Advocacy Actions, which is essentially actions that you can take any day, every day, to help elevate your voices and have them heard. And so the first is interacting with your legislators. As simple as calling your legislator, you can call the Capitol switchboard, and in about 90 seconds, you can leave a message for your legislators or talk to a staffer on the phone and tell them about an issue that matters to you. We have what we call Docs on Call sessions at Doctors for America, where we have protected time to call our legislators about advocacy issues, and we develop call scripts. There's many call scripts that you can find online, and you can even write call scripts and share them with your colleagues, which some of my colleagues and I have done. And then after you call, you can post about it on social media, tag your legislators, again, amplify that voice and encourage others to call. You can participate in a Hill Day. So, here we are as members of the FDA task force visiting Capitol Hill in Washington, meeting with senators and representatives across parties to talk about things that matter most to us. And so meeting with legislators and being able to not only talk to them about the issues that matter to you, but build those relationships, be able to serve as a resource and a source of information to your legislators. Most of them aren't physicians. Most of them don't have experience in healthcare. And so your experiences as the front lines of healthcare, caring for patients every day, are really, really important. You can post on social media as simple as a social media post, which could be as easy as, a tweet or a short message about a bill that matters to you or an issue that matters to you. Could be as complex as this beautiful infographic in the middle about how Medicaid cuts affect patients. This was developed by one of my colleagues at Doctors for America. It can be infographics about diseases and vaccines, like these measles infographics. And videos are also a great way to post on social media. We'll talk about videos a little bit more in a bit, but this is a video that I actually made during COVID in 2020 when I was still a medical student, trying to encourage friends and colleagues to stay home and to social distance to help protect the healthcare workers who go into the hospital every day. So making a video is one of the easiest things that you can do. We all have a smartphone at our disposal, and it takes as little as 90 seconds to make a quick video about something that matters to you. So it can be as quick as either of these videos, done by two of our colleagues in the community health and prevention about Medicaid cuts and about, advocating for our patients. Or it can be, a kind of more complex video that you put together, like this one in the top corner that several of us at Doctors for America contributed to try to advocate for physician voter advocacy, so greater physician engagement in voting, and shared across our social media platforms. You can take part in an advocacy action, and that can be many different types of actions, including using a call script, sharing an infographic, or attending a rally. Here, several of us in the Pennsylvania Doctors for America chapter are at a rally on the anniversary of the Dobbs decision, where we marched to protect one of the women's reproductive health clinics in Philadelphia. You can speak up and you can amplify your voice about the issues that matter by either speaking at a protest or a rally, engaging with the media, and Doctors for America has a lot of resources on media engagement, speaking at protests outside of the Capitol. You can even participate in different means of media engagement, such as participating in podcasts talking about public health issues, talking on the news or being interviewed about public health issues, or even writing op-eds or statements and sharing that information with others. Op-eds, particularly in your local newspapers, are a great way to reach an audience about an issue that's very specific that may not always get information on that issue. And so here's an op-ed written by Alyssa Lambrecht, one of the co-chairs of Community Health and Prevention, who talked about how Kentuckians must care about public health cuts because the impact of these cuts would be devastating. And so, New York Times is great, but really publishing on the local level is a great way to make sure that you're reaching some of the audiences who need this information most. And you can share your expertise. You can educate, you can teach, you can go and you can testify again in front of your local or your state legislators. You can present. Here's Dr. Jen Crumbs presenting at the FDA. You can present in front of Congress. You could testify in front of Congress, like Dr. Reshma Ramachandran did with Senator Bernie Sanders testifying in front of Congress. And advocacy is most fun when we do it with friends. You'll make a lot of friends along the way in your advocacy journey, but also recruiting your friends and bringing them in is a great way to get involved. There's power in numbers, and I got into advocacy because Noah Orlitsky, my co-chair, is one of my closest friends and invited me to participate. And I've invited some of my colleagues. And the more that, we advocate together as friends, the more that we bring joy to our advocacy. And advocacy should be fun. Together, we can make big changes. And so finding the issues that matter to you, finding ways to advocate, even just the simple daily actions that you can do, and doing it with friends is really key, because together we can make big changes and the world needs us now more than ever. Thank you.